Hello, my name is Dr. Newt Maney. Welcome to the IAS Academy ClearSmile Brace webinar on anterior alignment orthodontics for general dental practitioners. The IAS Academy offers a complete pathway from simple to comprehensive orthodontics for general dental practitioners, starting from simple removable appliances which offer anterior alignment orthodontics up to a 12-month teaching course on comprehensive orthodontics. The IAS Academy's teaching faculty consists of specialist orthodontists and highly experienced general dentists from around the world. In recent years, there's been a significant increase in the elective adult orthodontic claims experienced by the dental indemnity companies. General dental practitioners carrying out orthodontics without special training account for most of these claims. Non-specialists hit far more problems in relation to case assessments, underestimating the complexity and risks of treatment, not referring appropriately, and not recognizing when they are in trouble. So what goes wrong with these cases? Tends to be dissatisfaction with the outcome of the treatment, which is normally the aesthetics. Collateral damage, such as things like extractions or inappropriate interproximal reduction or slicing of the teeth. Relapse post-treatment, not referring when appropriate. Dissatisfaction with the treatment time that the case has taken, especially when the patient may have been promised a treatment time which may have only been just a few months. So where does it go wrong? The vast bulk of cases falls down to the poor diagnosis, poor case assessment, and not creating an appropriate treatment plan. Communication and consent, where the dentist has not relayed to the patient what the potential pitfalls of the treatment are, or what the outcome of the treatment could be, and what aspects of the malocclusion they may not be able to resolve. If we look at the actual chart here, you see that the actual treatment does not comprise the major component of where the errors occur. It actually falls down fundamentally to the diagnosis and assessment and the communication of the treatment plan to the patient. One can often presume that dental claims in relation to orthodontic treatment can be quite minor, but in actual reality, many claims can actually reach a five-figure settlement. So you can see why the dental protection organizations and the General Dental Council are exhibiting some concerns over the GDP orthodontic market. It's because of these increasing medico-legal issues that our IAS training director, Professor Ross Hobson, who is a consultant specialist orthodontist, has put together the IAS Training Academy's philosophy, which is correct assessment, correct diagnosis, appropriate treatment planning, and delivering appropriate treatment. In fact, Professor Ross Hobson has been quoted as saying that the right person should be doing the right thing at the right time because patient safety is paramount. ClearSmile Braces training is not a two-day course. It is a continuum of education with full case mentoring, continual support, and following an accreditation pathway which can lead on to further orthodontic training. The course is the very first step. Over the last decade, there has been a phenomenal increase in the number of patients who have been seeking to improve their smiles with cosmetic dentistry. In fact, in a 2012 dental survey, they estimate that there will be a 21% growth in the cosmetic dental sector in the next 5 years, where patients are continuing seeking straighter, whiter teeth. What has been driving this market is obviously the media and in particular celebrities. The example here is Cheryl Cole, who notably had her smile significantly improved with a combination of some orthodontics and some veneers. And in fact, when she had her smile improved, in the year that she was voted Celebrity of the Year, when she went to collect her award, she actually thanked her dentist for her new smile, which obviously raised the profile of cosmetic dentistry and the dentist in being able to help people improve their smiles. Another survey is by the British Orthodontic Society, which was a YouGov poll in 2010. It showed that 45% of the UK adult population are unhappy with their smile. And if you think about that, that's a significant number of millions of adult patients. And 20% of those would even consider wearing traditional metal braces. So that one can therefore perceive that there's quite a substantial potential market for the future. In fact, if you look around your own clinics, or if you look on the population that you may come across on the tubes or at your place of work or when you go shopping, there are many, many patients out there who have maybe crowding or spacing or general asymmetry of their smile. Now, a lot of those patients may be happy with their smiles today, but there's a growing number of patients whose perceptions about their general well-being is changing, and over time, those patients are beginning to seek correction or improvement of their smiles. In fact, Jonathan is one of those patients. He came to my clinic asking to improve his smile, which we did using the ClearSmile brace appliance. Now, the reason why adult patients are beginning to accept fixed appliances on their teeth is because of products like the Aesthetic Plus bracket, which we use with the ClearSmile brace appliances, which are crystal clear, comfortable, low profile ceramic brackets, and they are combined with tooth colored wires, making them far more discreet and far more socially acceptable for many adult patients. So if we have a case here like Diane, she was able to improve her smile within a short period of time, which is about 4 months, by aligning her anterior teeth. In fact, when she started her treatment, she hated her smile so much, and the terminology hate is a very powerful bit of language there. And you imagine the psychology of a patient who actually physically hate a smile, obviously will have a big psychological bearing. So as soon as we're able to align her smile and give her the look that she desired, her confidence and the way she felt about herself completely changed. And then her post treatment quote was, "I love my straight teeth." Another example here is Jane, who in the period of 5 months with Clear Smile Brace, we were able to transform her smile and give her that confidence where she initially started off with a quote saying, "I avoid smiling in my pictures," which, if you imagine how we'd perceive someone who basically didn't smile, who shied away from the camera, tried to not smile in public, may put her hand in front of her mouth because of a lack of confidence. That all has an effect on the way we perceive someone, the way someone can express themselves. So being able to transform someone using the ClearSmile brace appliance in a few months is quite remarkable. And the lovely quote that she gave afterwards is, "I just can't stop smiling." Another great example is Andre. In the period of 5 months, we transformed him from his quote, which was, "My girlfriend hates my front tooth," which was his upper right one. And by literally placing the ClearSmile brace appliance, we're able to improve the symmetry of his smile. And he was nicely quoted us afterwards as saying, "We are now getting married." Now, as you can see from Andre's smile, not everyone's looking, not every patient's looking for the perfect Hollywood smile. In fact, most patients are just looking for an improvement. They're just looking for balance. They're looking for natural smiles, but they want symmetry and improved aesthetics. So if you have a patient who currently comes to your chair wanting to improve their smile, what options do you have? The first option is to refer them for traditional orthodontics. Now, in my experience, many patients where can be the desirable treatment option tend to decline traditional orthodontics because it tends to be a treatment plan which is too protracted for them. The other option that sometimes patients seek is a placement of a restorative solution, which can involve crowns, veneers, bridges, and potentially extraction of teeth, and in certain cases, soft tissue and bone surgery. So a case like this, which I'm in this picture, if we're trying to restore them restoratively, would be very difficult to do and would be quite aggressive in terms of dentistry would have to deliver. So most patients who don't want to have elaborate comprehensive orthodontics or don't want to have their teeth substantially prepared or extensive dentistry done restoratively are faced traditionally with no treatment option. However, there is an option that is available which we call anterior alignment orthodontics. So what is anterior alignment orthodontics? It is a leveling and aligning of the anterior teeth using aesthetic orthodontic appliances to improve the smile. If you notice, we did not use the terminology of time here. You may have heard references with other orthodontic companies of the term short-term orthodontics. With ClearSmile brace, we divorce ourselves from the terminology of time because our aim is to get the best aesthetic outcome for that patient, and most of our treatment will be lower in treatment time compared to traditional orthodontics because we're not having a comprehensive approach to the complete malocclusion, but only focusing on the anterior teeth, which takes less time to resolve. And as you can see from here, I think that's a good option for patients where the alternative would be far more aggressive, such as in this case, which involves a substantial preparation of the teeth for veneers and crowns. And one does have to remind ourselves of the old test, which is called the daughter's test, which is if that was your daughter, would you prepare your daughter's teeth in the same fashion if the majority of those teeth were actually, as in this case, virgin teeth? Bearing in mind the long-term biomechanical issues which those teeth will face because they've been irreversibly damaged by the preparation of crowns and veneers. In fact, today, the contemporary approach to cosmetic dentistry and smile makeover dentistry is by using a more minimally invasive approach, and it's termed ABB, which is align, bleach, bonding, and recontouring, which is a three-step smile to a smile makeover. So if we look at this particular example here, where a patient has come in seeking a straight white smile, that can be achieved just by aligning the anterior teeth, correcting any tooth wear or tooth shape anomalies with cosmetic bonding, and carrying out simultaneously some tooth whitening. So as we touched on a little bit earlier, why do most adult patients decline traditional comprehensive orthodontics? Number one is the appearance, because they do not consider it socially appropriate for them, especially if they're adult patients, to have metal brackets placed on their teeth, especially as you can see here from America Ferrera from the Ugly Betty TV series, where the concept of her ugliness was perpetuated by the placement of these metal brackets. The other area where patients are concerned about having orthodontics is about the protracted treatment times, where they can run from a year and a half to up to 3 years, which for many adult patients does not fit in with their work or social schedules. Why do patients tend to say yes to appliances like ClearSmile braces? Because we're using clear brackets, aesthetic clear brackets with aesthetic tooth-colored wires, making the braces far more discreet and far more socially acceptable. And also, because we're focusing on the anterior teeth only, the treatment times are going to be substantially lower, ranging between 4 to 12 months, which for many adult patients is pretty acceptable. Aligning the anterior teeth only on an adult patient can have a substantial change to the way that the patient feels about themselves and about the way they look. And this is well recorded by research, such as a study by Gazelle and Rapport, which is on the psychosocial reward of orthodontic treatment in adult patients. One must not underestimate the improvement in self esteem and the benefits you can have for a lot of patients by offering this sort of treatment. So, where do you stand medically legally as a general practitioner offering this style of orthodontics? With any indemnity company, as a general dentist, you're able to offer any treatment which is within your skill base. So, provided you have appropriate training, you can offer any treatment such as endodontics, periodontics, implantology, orthodontics, provided you have the skill set to deliver that treatment. And if the treatment is beyond your capability, you must refer to an appropriate colleague. What is the difference between comprehensive orthodontics and anterior alignment orthodontics? The goals with comprehensive orthodontics are different. The aim is to develop a class 1 dental relationship, which means a class 1 incisor relationship with normal overbite and overjet, relieve all crowding and close spacing, to achieve ideal root inclinations buccolingually, and to correct any dental midlines and making sure they're coincident with a facial midline. So how does anterior alignment orthodontics differ? The goals are to align the anterior teeth, relieving anterior crowding or spacing, to improve the symmetry of the anterior teeth, which is correcting any gingival discrepancies or incisal edge margins, possibly prior to any restorative treatment. We are accepting any anterior-posterior dental relationship. So if the patient is class 2 dentally or class 3 dentally, we'll be accepting that malocclusion. We may not, in many cases, achieve ideal root inclinations, and we're not able to correct the midline by more than 1 to 2 millimeters. AAO is not comprehensive orthodontics. As Professor Ross Hobson has been quoted as saying, anterior eye alignment orthodontics may or may not be a compromise of what is acceptable to the patient and you as a dentist, but AAO is not about a compromise in the standards of care. Limiting the orthodontics to aligning anterior teeth for aesthetic reasons inevitably takes less time than resolving the patient's entire malocclusion. However, the treatment philosophies, which is full case assessment, full treatment planning, and full diagnosis, is the same as it would be with comprehensive orthodontics. What type of movements are possible with using the ClearSmile brace appliances? We're able to offer a range of 3D movements. One of those is tipping, which is a proclination or retraction of the anterior teeth. The other form of tipping is where we move the root mesiodistally, upright in the teeth mesiodistally as well, and that's called tipping. We can also correct any rotations that are present within the anterior teeth. We can also correct any intrusions in the anterior teeth. As well as extrusions. We can also carry out some mild distalization where we can create some space distal to the canines to retract them slightly to then help us align the anterior teeth as well. With a ClearSmile brace appliance, we are also able to correct the buccolingual root tip, which is called root torquing. So we can upright the teeth buccolingually to make sure the root apex is in the correct plane. So we do carry out anterior root torquing for aesthetic reasons, because if you don't carry out the correct torque relationship, you'll find that the teeth tend to look flared and the gum margins tend to look much shorter than they really should be. One thing that we can't do is what we call expansion, which is where we use the appliances to develop the arches or expand the arches. To be successful with ClearSmile brace appliances, it's very important to understand the limits of the treatment. ClearSmile brace training is not a replacement for comprehensive orthodontics. You will not be able to, within this short course like this, be able to provide comprehensive care and resolve all malocclusions. In fact, the IAS Academy does have a comprehensive orthodontic course run by Professor Ross Hobson, which spans over 13 months with 17 days worth of training built into 5 modules. So you can see by comparison, it's far more in-depth and protracted than a simple course like this. Therefore, to be successful, the first thing we need to do is to make sure that the cases are appropriate that we're treating. And this starts off with a proper case evaluation, which involves a full orthodontic assessment. Then from that assessment, being able to produce a diagnosis and a list of problems within that malocclusion, and then being able to write a list of treatment options available to resolve those list of problems, and then discussing those treatment options with the patient to then work out between yourself and the patient what would be in their best interests according to what they're willing to undertake to complete their treatment objectives. It all starts first of all with carrying out the proper orthodontic records, which need to be a full set of 13 orthodontic views taken ideally with a digital camera, a good set of study casts, and taking appropriate radiographs where needed to ensure dental health. Cephalometrics are not necessarily needed in anterior alignment orthodontics. However, you may sometimes need it in cases for comprehensive care. In the orthodontic assessment, it's important to evaluate the medical history, to list the patient's chief complaint and to why they're seeking orthodontic address, to examine the TMJ and the joints to make sure they're asymptomatic or to check they're free from any degree of discomfort. We need to evaluate extraorally the skeletal relationship, the facial height, the FMPA, the asymmetry of the face. We need to look at the soft tissues and look at the nasolabial angle, whether the lip support, lip competency, whether the patient has any habits which may be contributing to malocclusion. We look at what teeth are present and the classifications of the teeth. Are they class 1 or class 2 or class 3 molar, canine, and what the incisal relationship is. We need to know what the overjet and overbite is, what the center lines are, and how those relate to the facial midline. We also need to evaluate if there's any posterior crossbites and if this is causing any displacement and closure. We need to report on the radiographs that we've taken. From this assessment, we need to then create a diagnosis, and from that diagnosis, we can produce a problem list, and then we can then split that problem list into what could be treated idealistically, and if we're going to treat it with anterior alignment orthodontics, what our treatment goals would be, and what the 2 treatment plans would be if they were comprehensively approached, or whether they were going to be treated with anterior alignment orthodontics, and those would then be presented to the patient. Now, the ClearSmile braces orthodontic assessment form is a standard form that we have put together to help the practitioner be able to carry out an assessment very logically and very systematically and very efficiently. And we've put that together to help encompass the diagnostic process and the production of a treatment plan. With all orthodontic treatment, it's very important that you do discuss for consensual purposes all the treatment options, both orthodontic and restorative. You need to explain obviously the importance of retention, because many of the cases that you'll be treating are patients who had orthodontics as a teenager, but now in their adult years, their teeth have relapsed. anteriorly, and therefore we need to explain that any orthodontic treatment will be prone to relapse and will require ongoing retention. We need to also make it clear if we're carrying out anterior alignment orthodontics only, what compromises we're making to the general malocclusion, especially posteriorly, and the patient needs to be aware what those are and what the potential risks or benefits of leaving those untreated are. It's very important that all of this is carried out in a consensual process, which is not just getting the patient to sign a form, but actually sitting with the patient, going through the different treatment options and the benefits and risks of each one. One thing that we're very clear about with ClearSmile braces is that we only offer this treatment for adult patients. We feel that minors do not have the same social or time constraints as an adult patient, and therefore they should achieve comprehensive care idealistically, or at least a evaluation by a colleague, a specialist colleague, with regards to the potential for comprehensive care. At ClearSmile Brace as well, we do have a consent form which should form the basis of your discussion with the patient. So to reiterate, it's very important not to blur comprehensive orthodontics with the anterior alignment orthodontics. And we must remember that the aim with anterior alignment orthodontics is focusing on the anterior teeth only, and we're aiming to improve the anterior teeth in terms of the aesthetics in line with the patient's aims and goals. Basically, anterior alignment orthodontics is really cosmetic dentistry, where we're just basically improving the way that the anterior teeth look and improving the balance and symmetry. If we look at this case, where you can see that the anterior teeth are crowded, if the patient comes in complaining that their front teeth are crooked and they would like to straighten up their front teeth, as you can see, the premolar is rotated as well. In fact, this patient had a previous extraction of the upper right 5. The chief complaint is not to resolve that premolar, it does not concern the patient, then we make no attempt to ratify that posterior rotation and focus on the anterior teeth only, because that is what the patient is seeking to address and falls into the concept of anterior alignment orthodontics. And that applies to things like unilateral crossbites, such as in this case, where you can see the patient on the left-hand side has a complete unilateral crossbite. However, the patient's chief concern was they didn't like the way that their front teeth looked, particularly the prominence of the canine and the instanding laterals. By getting those anterior teeth aligned, which happens quite quickly within a few months, was enough for the patient to be happy to just pursue an anterior alignment or solution only, rather than carrying out full comprehensive orthodontics to resolve all the posterior malocclusion as well. So what is the ClearSmile brace appliance? It is basically what we call straight wire orthodontics, which is a bracket which has a slot, and then you take a wire which then engages the slot, and that wire can drive that bracket to move in a certain direction, and that bracket of course is attached to a tooth, which then obviously subsequently moves the tooth. The wires that we use are super elastic night eye wires, which have elastic memory in them, and if you take a super elastic night eye wire and you bend it, as soon as you let go, the wire will regain its shape. So if you take that wire and you then attach it to the brackets which have been mounted on the teeth, as you can see in this example here, because the teeth are crooked, the wire is now crooked. Because the wire wants to regain its natural original arch form, the wire will basically iron itself out and become straight again. As it does that, it carries the teeth with it, and the teeth also level and align. And this happens in a three-dimensional way, where the teeth will move buccolingually, intrude, extrude, and obviously you will have some degree of, in particularly in our scenario, of having some root talking as well. Leveling and aligning using fixed appliances is always quicker than if you use a product such as a clear liner. Clear liners tend to be more inefficient at moving teeth, and they tend to struggle more in movements such as extrusions or difficult rotations. Leveling and aligning with fixed braces happens in most cases within a few months, as you can see from this case. And it's simply by just applying a series of wires to the brackets and the wire just driving the movement of the teeth. At ClearSmile braces, we use a selection of different wires of different diameters and different forms. They can be either round wires, square wires, or rectangular wires. We either use nickel titanium superelastic wires or beta titanium wires, which tend to be a little bit stiffer. And again, we use different gauges. The general sequence is a simple one. We follow different gauges of the night-eye wires, the 3 wires in the basic sequence. If we need to carry out some root torquing for aesthetic purposes, then we just add 2 more additional wires. But most cases which involve simple anterior alignment of leveling and lining will be just simply the 012, 016 and the night-eye 2020 wire only. So here's the video again showing that root torquing. If we need to use the 2 additional wires, we can upright a root tip which may be displaced, in this case palatally, and getting that root tip uprighted, which substantially improves the aesthetics by removing the flare of the tooth and improving the gingival contour. One thing we do need to remember, orthodontics is orthodontics. There is no such thing as a special bracket wire. There's no such bracket wire which will move teeth quicker. What we use at ClearSmile braces is standard orthodontic components which are used by orthodontists worldwide, and they're used in their comprehensive orthodontic cases as well. We need to remember that teeth will move at a maximum of 1 millimeter a month because of biological bone remodeling rates, and therefore it's irrelevant what appliance you use or what wire or bracket you use, because the teeth can only move at a certain rate. In fact, if you try and provide excessive force to a tooth to try and move it quicker, you actually will slow down the treatment, because as the teeth are trying to move too quickly, you'll get compression of the periodontal ligament to the point where you get necrosis, and that causes hyalinization, which is then completely interrupts tooth movement. Now, it's very important when we're using straight wire orthodontics that that bracket is placed in exactly the right place, and we call it the facial access point, which is the midpoint of the crown in the long axis of the tooth. Making sure the treatment runs fluidly, it's very important those brackets are placed very accurately. Now with ClearSmile brace, we take that pressure away from you, because to do that sort of placement directly takes a lot of skill and a lot of time, and is very difficult, very accurate, unless you have a lot of experience. We help you out with the use of what we call indirect bonding trays, where we place the brackets on a model of the patient's teeth in the laboratory by our skilled technicians, orthodontic technicians, and then we create a bonding tray which carries those brackets to the mouth, and then using a simple process of etching and applying some bond and a loosened cement, those brackets can be adhered to the teeth in a matter of minutes. The advantage of indirect bonding trays is they're very accurate, because if you get the brackets in the right places, you have very little finishing to do at the end of the treatment, and the teeth go exactly where you want the teeth to go. Also, with placing individual brackets, it can be very time consuming and can be quite stressful, especially when you're very inexperienced. So by having everything preset for you makes the treatment time far quicker and far less stressful, and obviously because it takes less time, it's going to cost you far less time of your surgery time, and therefore it's far more cost effective relative to the running costs of your dental surgery. Steps for bonding a bonding tray are very simple. You take the tray, which has the brackets already mounted inside. We apply a little bit of Bond and a little bit of the lutein composite. The one we use with the Aesthetic Plus system is Transbond LV. We then etch the teeth, rinse them, dry them, apply a little bit of Bond. We don't cure the teeth yet. We then take the bonding tray, apply it over the teeth, and then we cure it with a ultraviolet light, curing light, for 20 seconds per tooth, whatever your curing light speed is. We then remove the bonding tray, and that will leave the brackets bonded to the teeth in exactly the right place. Now, the big advantage that ClearSmile Brace has over many other orthodontic training programs is that the ClearSmile Brace follows the philosophy of the IS Academy, which is digital treatment planning, which allows the practitioner to have a lot of control and predictability to the treatment outcomes before they start. Before I talk about digital planning, I just need to cover some terminology that I'll be bringing up very shortly, and one of those is interproximal reduction, or predictive proximal reduction, which is where we're creating minor spaces between the teeth by removing some enamel or making the teeth a little bit narrower, and this helps us create space to resolve crowding. Spacewise is a digital software program which acts as a calculator to work out how much space requirement we'll need to get some teeth aligned where there is a lot of crowding present. Archwise is a three-dimensional orthodontic viewing software which creates a 3D model for you to visualize a case before you start as the potential to ascertain the potential outcome, and it will assist you in communication with the patient to try and attain consent before you start. Spacewise is a trademark product for the ClearSmile Brace appliance, which basically allows you to take a occlusal photo of a patient, upload it onto our software program, which is based at the ClearSmile Brace provider resource center, and using that software, you can map out the art shape that you want to create with the appliance, and then you can work out the mesiodistal width of each individual tooth, and then from that information you'll be able to ascertain how much space you need to create to get those teeth into that degree of alignment and into that particular arch form. Using that space-wise, we can then send it to the laboratory, giving them the guidance to then virtually move the teeth from the impressions you gave them to create a digital model, which you can then ascertain the visual outcome of the case and see and you can then evaluate what parts of the malocclusion, particularly posteriorly, you aren't correcting, and what the visual aesthetic outcome would be, and that helps tremendously in the consent process, because from day one the patient will understand the limitations or the benefits of the treatment. And here is a STL file of the Archwise software showing, which you can then manipulate to show the patient what the teeth would look like post-treatment. Now, if the space-wise planning has been done correctly and the assessment and diagnosis has been done correctly, then the information we relay up to the laboratory to help and produce the Archwise should be very accurate. And if you can see from this example, the post-alignment model, which was predicted by the technician, has now been superimposed onto the patient's smile, and I'm going to now show you the post-treatment outcome. And as you can see, it should be pretty similar to the predicted model. The beautiful aspect of having predicted models is that you can also spot any issues like anterior tooth wear or differential wear, which could require post-treatment restorative bonding to give those teeth a much more even, symmetrical appearance. The Archwise program also produces a static PDF models for you to look at the teeth in different angles, which also helps you directly visualize the outcomes. And it's probably a little bit more easier to interpret than a three-dimensional STL file, which you can put on a virtual viewer. Again, I want to show you a pre-case and a predicted outcome case. I'm going to superimpose the pre-op photograph and then superimpose the post-op photograph, and you should be able to see that the post-op photograph is pretty similar to the predicted Archwise model, and therefore, if you carry out the protocols correctly, your predictive models should be very accurate. The other advantage of the Archwise software is it will actually produce a guidance on the amount of IPR or PPR that will be necessary to line those teeth, which will help you substantially in deciding where you're going to carry out the IPR, and it will confirm whether the case is appropriate for anterior alignment orthodontics or whether the IPR requirement is in excess of our guidelines and require referral for potentially extraction orthodontics and comprehensive care. Following orthodontics, retention is critical because studies show in comprehensive orthodontics that 10 years after retainers are stopped, 70% of cases relapse and require retreatment. In fact, the current guidance by the Royal College of Surgeons is that orthodontic retention should be for life. With ClearSmile Brace, our recommendation is a combination of fixed and removable retainers, which is the Essex retainer or bonded intercanine retainer for any arch we treat, and that should be for life. The one advantage of having digital treatment planning is that we can actually, using the different appliances within the IS Academy, we could actually simultaneously treat the arches with the different appliances, because it's not always appropriate to maybe place fixed appliances in both arches. You may want to use clear liners in one arch, or maybe the Inman line in one arch, and maybe a fixed appliance in the other. Because the cases are digitally planned, the teeth can be, the digital alignment models can be used to create the clear liners or the Inman liner as well, and the progression or timing of something like the clear liners can be altered to try and follow it in line with the treatment projections for the ClearSmile Brace appliance. Now, with ClearSmile Brace training, it's very important as a new practitioner, an experienced practitioner, to fix appliances, that you have a very solid foundation and support to help you gain the experience that you acquire and increase your knowledge base through close one-to-one mentoring. The way we do this is by using our support forum, which is free to all ClearSmile Brace users, and it consists of a team of orthodontic specialists and very experienced GDPs, and we're there for you to guide you with your cases and help you develop the confidence and the skill set to be able to provide anterior alignment orthodontics competently. What comes back from our laboratory is the digital bracket kit, which contains all the orthodontic components that you require to complete that case, without the need for you to store significant quantities of orthodontic components, as say an orthodontist would need to, because most general practitioners are not going to be doing the same volumes of orthodontic care as an orthodontist would, and therefore having thousands of pounds locked in stock would be financially impossible for these practitioners to be able to carry out orthodontics well, and therefore the digital bracket kit are individualized patient kits which contain the necessary components, the wires and the brackets and the ties, which are specific for that particular case. And let's have a look at how we would treat a case step by step using the ClearSmile brace protocols. First thing that we need to do is to collect all the orthodontic records, and once we collect the orthodontic records, we're going to carry out a full assessment, which includes assessing the patient's vertical midline for things like midline discrepancies and facial asymmetries. We're also going to evaluate the patient's facial proportions, in particular the lower face height. We're going to look at the patient's Frankfurt mandibular plane angle, and we're going to also assess the patient's nasal lip line. We're also going to evaluate what the patient's chief complaint obviously was and where the lip line was in relation to the age of the patient. We also will evaluate the dental midlines in the upper and lower arches. We would evaluate the canine relationships, the molar relationships on the left-hand side and on the right-hand side, and we'll also evaluate the overbite and the overjet and the patient's incisal relationship. We also will make a determination of the amount of crowding in the upper and lower arches. We will then record all of this on our orthodontic assessment sheet so that we've got a record of those evaluations. We will then produce a case summary and a diagnosis of the patient's complete malocclusion. And using that diagnosis, we'll formulate a problem list of what that patient has in order to rectify their malocclusion. We will then formulate a treatment plan which is aimed towards idealism, which is correct all aspects of the malocclusion, and an alternative treatment plan, which is a compromised treatment plan in certain cases, which involves only approaching the anterior teeth and what the aims and objectives would be there, and what parts of the malocclusion we will be leaving untreated. We will then formulate a treatment plan according to which plan we're planning to proceed, whether it's the ideal or compromise option, which will then present to the patient for their consent. To help us evaluate the amount of crowding and whether the case would be appropriate for anterior alignment orthodontics, and to make sure that the amount of interproximal reduction falls within our safety guidelines at ClearSmile braces, we need to undertake a space-wise digital analysis, which only takes a minute or two using the online software, which is based at the ClearSmile Brace Resource Center. We can also use the software to try and decide on the arch form, because it's very important when we are planning fixed appliances that we don't over procline teeth or over flare teeth, because that has an aesthetic disadvantage and also can affect the post-treatment stability. We can control the degree of arch form by controlling the amount of flaring in combination with the amount of IPR reduction that is undertaken. And we do that with both arches. From this information, we then send it with the impressions and the bite registration to the ClearSmile Brace laboratory, which will then carry out a archwise analysis and produce the digital predictive models for you to evaluate that the aesthetics are favorable, that the teeth haven't been over proclined. You can also evaluate parts of the malocclusion which haven't been treated, so that again it will help you in the consent process, because you can show this to the patient so they fully appreciate what the potential outcome could be. It also will highlight any issues such as things with black triangles that may be forming where teeth which were once overlapping become to a line. You may have a shortened papillae, and that can be shown up on this space-wise analysis. And you can also evaluate for things like incisal edge wear, which will show up as incisal edge discrepancies, which will require post bonding treatments to give those teeth some incisal symmetry. The case we first started by using the initial 012 night eye wire in the upper arch. In the lower arch, we used an 016 night eye wire with indirect ligation of the instanding lower left lateral and something called open coil spring to help start opening up the space to allow us to then bring that lateral into the arch. After 1 month, you can start seeing that there's some degree of alignment coming through. We then went to the lower arch and we took out the 016 wire and dropped down to an 012 wire and then fully engaged, directly ligated the instanding lateral incisor. At month 3, we were then able to upgrade the upper wire into a 2020 wire, and we could also upgrade the lower arch because of the degree of alignment that had occurred, allowed us to comfortably fit a 2020 wire into the lower arch, which by month 4 meant that the upper and lower arches are now pretty much well aligned. There is symmetry and balance in the smile, and the patient is now happy and comfortable with the debond. So now we can have a look at what the patient's original concerns were, where she complained about the malalignment or the crowding of her upper and lower teeth, and by simply using ClearSmile braces and carrying out some post-treatment tooth whitening, we're able to give her a smile she was a lot happier with, a lot more comfortable with, and we basically satisfied the patient's chief concerns. We can look at her from a lateral perspective, and you can see with careful planning, especially using the digital protocols, we're able to assess and control the degree of flaring to make sure that the teeth are very fit inside the facial profile and not excessively flared. And as you can see, post-treatment, we provided with the upper and lower fixed bonded retainer, and on top of this, she would have also received an Essex retainer to wear nightly. And both retainers, she would have been made absolute clear from day one, would need to be worn for the rest of her life. The 2-day course is designed for dentists who are inexperienced with fixed labial appliances. It's a very thorough, intense course which covers in more detail orthodontic records, assessments, and diagnosis. We look at how to carry out the proper digital analysis using spacewise and archwise. We go over the fundamentals of orthodontic mechanics, how to actually bond up a case, how we approach crowded cases, carry out IPR correctly, and what protocols we need to follow to make sure that IPR is carried out safely. We discuss base cases. We talk about the wire sequences, what we need to do at each review appointment, how we handle deep bites, teeth that are blocked out, how we would torque teeth, how we handle high canines or difficult rotations, how we control overproclination to avoid excessive flaring, which can have a major impact on the facial aesthetics of the patient and their profile and can lead to dissatisfaction. We go through orthodontic instruments and the different names and uses for the instruments. We then practice hands-on exercises on the typodonts, practicing the different orthodontic procedures and protocols. We'll then talk about treating a single arch, how we finish cases, the retention procedures and protocols, how we manage the occlusion and the importance of various aspects of the occlusion. We will talk about how you actually start a case, how we will then support you and mentor you post-course. We go through a case review together. We have a implementation session where we can review cases you were brought to the course for us to review of any potential cases you thought might be suitable for potentially ClearSmile braces. We then go through some cases for you to properly assess, diagnosis, and treatment plan so you can correctly get the skill set to start looking at your patients and produce assessments and diagnosis and treatment plans competently, and then we can work together to formulate the treatment biomechanics to deliver that case and get the outcome that we're planned to achieve. The conversion course is designed for experienced dentists who are familiar with fixed appliances. The key aims of this course is to go over the case selection criteria and the treatment protocols as developed by Professor Rob Hobson so that the GDP can deliver orthodontics safely without transcending the line of approaching cases comprehensively or getting into the grey area of comprehensive orthodontics, which can make them legally vulnerable. We teach you how to carry out cases digitally using our exclusive software, which is Spacewise and Archwise, so you can pre-plan your case and then work towards that outcome using the correct biomechanics. Once you've carried out the courses, you can then become eligible to become a CSB provider. To become a regular provider, the requirements are that you undertake the pre-course webinar. So we actually do a webinar beforehand. We then attend the course, whether it's the 2-day course or the conversion course. And once you've completed that course, you need to carry out a test, post the course, and once you've completed that test, which is an MCQ, successfully, you then be allowed to become a ClearSmile braces provider. And the reason for this accreditation process is to make sure you've understood our protocols and that you're safe to deliver ClearSmile brace appliances to patients. To maintain that status, we simply request that you submit 3 cases per annum to our forum for mental review so that we can make sure that you'll continue to be safe as a prescriber of ClearSmile brace appliances. The next level is to become a ClearSmile brace accredited provider. The advantage of becoming an accredited provider is to show that you're competent and accredited to have a decent skill set at delivering ClearSmile braces appliances and delivering anterior alignment orthodontics to a good standard. And that will give you the advantage of being listed higher on our dentist locator on our ClearSmile brace website. The requirement is that you complete 5 cases and send them to review to Professor Hobson using your pre and post photos and a completed assessment form and treatment planning form. To maintain this status thereafter, you would need to submit 3 cases to Professor Rob Hobson for review, and if those are successful, you will continue to be afforded the ClearSmile Braces accredited provider logo, which again will maintain you on the higher status on our dentist locator. ClearSmile Braces can bring you great success to your clinic. This sort of treatment is one of the most profitable procedures that you can undertake in your dental practice. Profit ratio is about 8 to 1, and if we look at the average, to highlight this, if we look at the average case of an upper and lower case being treated using the ClearSmile brace appliance, the normal charge that dentists are making to their patients in the region of about £2,800. If we deduct off the digital bracket kit, you can see that the net cost to the dentist is £2,361, which the average treatment time for the most cases is around about 4 hours. So that's a net hourly rate of just under £600 an hour. So it's a profitable treatment, which provides a lot of satisfaction. It has a lot of patient demand. It's patient driven. The other big advantage is that it's a very rewarding for a clinic, and it helps to build up the cosmetic component of the clinic, because many patients would come in for anterior alignment, normally post-treatment need a lot of restorative attention, such as bonding or correct replacement of crowns or fillings. So let's look at how this would impact a clinic. If we look at the average anterior alignment orthodontic provider in the UK, they on average see about 1 case or start a case per week. That's roughly about 52 cases being treated per annum. which gives them a turnover of just over £145,000. If they deduct the laboratory fees, that gives them that's a net profit above what they're already profiting on their clinics of £121,000 plus per annum. If you look at a slightly higher provider who may be doing maybe 3 new cases a week, that completes roughly about 156 cases per annum. That's a turnover of £436,000 per annum. If you deduct the laboratory fees off that, that's a net of £365,000 on and above their normal profit margin. So providing this sort of treatment could have a substantial effect on your bottom line and can change the success of many clinics. And the beautiful part about this sort of treatment, because it's so profitable, it means you can provide it to a high standard. You can afford to invest well in the treatment, spend the time on the treatment, get the diagnosis right, and deliver the treatment to a high standard. And also your practice will benefit, your staff will benefit, and you're able to invest in other parts of your clinic as well. What I'd like to do now is to show you some photos which highlight what happens on one of our 2-day hands-on courses. Thank you for listening to me on this ClearSmile Brace webinar. If you'd like to find out about any of our courses on the IAS Academy, which are either the simple removable training courses up to the comprehensive courses, or if you'd like to find out a little bit more about the ClearSmile Brace 2-day hands-on course or the conversion course, please visit www.iasortho.com. Thank you for listening to me, and I wish you all the best in your GDP orthodontic career. Thank you.